All right, great. Well, I am going to go ahead and get started since we are at time. So everyone, welcome to Tennessee's Rare Disease Day event. Thank you so much for joining us. We're really excited to be celebrating the rare community with all of you today. So we are just starting off our events with a quick disclaimer, noting that NORD is not a provider or a healthcare facility, so anything that's shared during today's event is not a specific recommendation or endorsement for any treatments. So I am going to go ahead and share 2 quick videos to welcome you all. Oops.
I am Tristan.
Angelina.
Nama saya Syafiq.
Regina.
Habari asubuhi, Javi.
Jeg Jon Christian og jeg bor I Norge.
I live in the United States of America.
In Australia.
Malaysia.
No Brasil.
Tunaishi Kenya.
My passion is for fashion and design.
I love to dance.
Menyusur hutan.
Para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu.
Jeg elsker idrett og spiller spill med familien min. Minhas paixões são minha fuga quando as coisas estão difíceis.
Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk.
Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador.
Atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumuona mtoto wangu wa kiume anavyofurahi tunapoenda nje. Nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik perhubungan dengan masyarakat yang tak pernah saya sedar wujud.
Å være uavhengig på grunn av menneskene rundt meg.
Their fierce support.
Sua bondade inabalável.
The big one.
Mine venner.
Keluarga.
Enfermeiras.
Doctors.
Support workers.
Assistenter.
Mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekewa.
Histórias compartilhadas que me libertaram das dúvidas. Og ga meg selvtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder.
Saya Syafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey, ana SMA, spinal muscular atrophy.
Jon Christian og jeg har OI, medfødt benskjørhet. Esta minha vida.
Suara saya.
And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I'd like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today. And some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the Rare Disease Advisory Councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
Great, so I will go ahead and have Terry Jo give us an overview of what we will be hearing today and to share a little bit about herself.
Okay, everybody, can you hear me? If you can't hear me, wave or something. My sound's a little weird. So I am first and foremost the mom of a son with a rare disorder. My son's name is Lou Bichelle, and today is his birthday. He turns 22 today, and he was diagnosed with Angelman.
Oop, you cut out there for a second, Terry Jo. Let's see. I think you might be frozen there. I'll give it a second to see if it. Oh, I heard you for a second.
And maybe you will have to just go ahead and do the next part. Sorry about that.
I hear you perfectly now.
You can hear me? Okay, so sorry. So I was just saying that my son Lou has Angelman syndrome, and that was our introduction to this crazy rare disease world, which we knew nothing about before. And we did feel really lonely at the beginning. And now, 21 years later, we realize as a family that it's all the patients and the doctors and the clinicians, everyone sticking together around rare diseases makes it possible for us to find treatments and cures. And so I'm so excited to have been the ambassador to Tennessee, and so excited to have Amber and Nick on board, who you're going to meet soon. And even more excited about the Rare Disease Advisory Council that we just got started a few months ago, and we're already getting a lot done. And we have today, if you want to show the agenda, I think I'm going to go over that. We have today a speaker who is the chair of the Tennessee Rare Disease Advisory Council, and that was sponsored by Senator Shane Reeves from Tennessee. And we'll get to hear patient stories from Amber, from Nick, and from Jill Pratt, who will tell us about their lives as rare disease families in Tennessee. And so in the interest of not cutting out any further, I will go right along to the next section and thank everybody for all your hard work for patients with rare diseases. Together, we really will find cures.
Great, thank you so much, Terry Jo. And right here we have the contact information for Amber, Terry Jo, and Nick. So they can also be dropped there in the chat box. They're great folks to reach out to if you want to get more involved in Tennessee's Rare Action Network. Great. So with that, my name's Anissa Reed. I am the State Policy Manager here at NORD for the Eastern Region. And I'm going to briefly go over a little bit more information about what our Rare Disease Advisory Council is and why they're important. And then I'm going to kind of describe what our state report card is and why we use that tool at NORD. So let's start with the problem. So more than 25 million Americans are living with one of the more than 7,000 unique rare diseases. So that breaks down to about 1 in 10 Americans. Even though that may seem like a lot, state decision makers still have limited awareness of the issues and impact that rare diseases have on patients, their caregivers, and the overall healthcare system. So what is the solution? NORD believes it's to create RDACs, a diverse body to advise state government on the common obstacles that the rare disease community faces. We see this as an enormous opportunity for government officials and the rare disease community to work together to develop resources necessary to prevent and address barriers in a strategic way. There are a number of differences between RDACs in each state. Some of those differences include the number of members, the varied members of the rare disease community represented on the council, where the council works out of, and duties and accountability mechanisms. So overall, each RDAC has the same goal of supporting the rare disease community by increasing the voice of rare disease patients and caregivers within their state. So to date, 16 states have passed RDAC legislation. We also have several other RDAC bills that are currently being heard in other states. So we are, of course, as was mentioned, so happy and excited that Tennessee is one of those states that has an active RDAC. So we want to continue increasing the number of RDACs in the country to give as many rare disease advocates a voice in the state government as possible. NORD highly encourages that different state RDACs collaborate with one another to share ideas and best practices. We plan to continue to develop and release toolkits, one-pagers, host webinars, and convene additional meetings to support ongoing RDAC work. So as was mentioned, last year, Senate Bill 2124 with identical bill, House Bill 2505 was signed into law. A few duties that the Tennessee RDAC has is to advise the Drug Utilization Review Committee and the 10 Care Pharmacy Advisory Committee in their review of products and medications for the treatment of rare and orphan diseases. Also advising public and private agencies in the state in providing services for persons diagnosed with rare diseases. The DUR and PAC seeks input of the Advisory Council on rare diseases and personalized medicine to address topics for consultation. And then we have linked their website as well. It is a great resource and you can find out additional information about Tennessee's RDAC. And so please take a moment to check that out whenever you get the chance. So now I'm going to jump into an overview of an important tool that we use at NORD. In 2015, NORD launched its state report card with a goal of evaluating how effectively states are serving people with rare diseases. This year marks the 6th edition of the state report card, which was completed using data current as of November of 2020. So these are the policy issues that NORD's report card focuses on. It is important to note, however, that these issues are not exhaustive. These issues touch on several critical and relevant policy areas at the state level, but with each issue included, there are still many others that are capable of impacting the lives of rare disease patients. So how do you find out where your state measures up? So you can select your state by using our website in the link that is shared here and that is going to be dropped in the chat box. And each state's page will list all the policy issues and what grade has been given to them. So these are just small snapshots of some policy issues that impacted the rare disease community in 2020. Current legislation and changes that have been made so far in 2021 have not yet been captured. So if your state recently passed legislation to improve one of the policy issues, that likely will not be captured until the 7th edition. So the website also provides a detailed overview of the data, and you can learn more about each policy issue in the methodology section of the website. So if you have any questions about our report card, then you can always send us an email at policy@rarediseases.org. And it is now my pleasure to introduce Nick Parent, who is our Tennessee Volunteer Community Engagement Liaison. So I will hand it over to you, Nick.
Thanks, Anissa. Sound check, everything else sound okay?
Perfect.
Great. All right, so as Anissa mentioned, my name's Nick Parent. I'm the Community Engagement Officer, volunteer for the state of Tennessee, helping out Terry, Joe, and Amber as we want the community to get more connected and people to these resources. But as such, I want to share my story as well. Much like Terry, Joe, I'm connected by my kids. And full disclosure, every time I share this story, sometimes I'll get a little choked up, so just bear with me. I'm okay. It's actually a great story. So you see on the slide here, these are my girls. My wife, Elizabeth, my daughters, Leona and Camille. And both of them actually have PKU, which if you're not familiar with this is a metabolic disorder, which essentially leads to build up proteins in their system. Which can lead to developmental issues. And for every one of us that's familiar with newborn screening, this is a key reason why we have it today, and was one of the first diseases to be part of that newborn screening program. But just like Terry Jo mentioned as well, is I think everyone in this call, because we're connected to this community, is that we've gone through the different stages of finding out about our disease. That first diagnosis, in our case, days after birth when an abnormal reading comes back. The late night Googling and assuming the worst. The inability to maybe understand, is it treatable? Are there experts? What can we do about this? What in the effect does my child and my life look like going forward? So I can share with you, we've all had those shared experiences, but NORD has actually provided for me and my family as a connection to help and support in a community. We are actually exceptionally fortunate too that my girl's condition, even though can be severe, theirs is very mild. Mild in the case that we, with treatment, don't even have a diet change, which is not very common for this disease. They're developing normal. They're happy, super joyful little girls. And my main connection and what really got us connected to NORD was even some of what you would not expect as gaps for baby insurance. I am a strategic marketer for a large firm in Nashville. But previous to that, I lived in Houston and then Minnesota before that. But I've always worked for big companies with good insurance programs. And this is a medication and treatment that my girls can get. But what isn't always on the formulary, or there can be exceptions to these things, and you might not find out until it's too late. In our circumstance, my girls, Leona, the older one, she's the one on the treatment while the baby's only a year old, so she hasn't started yet. But we were a good 6-8 months into treatment, levels perfectly within healthy amounts, staying below our specific limit. When basically we got some letters, emails saying how my insurance basically wasn't going to be able to cover the remainder of the medication. And we were only, I think, in about July of that year. And much like many of you or the folks in your lives with rare disease, sometimes these medications are extremely expensive. That out of pocket is just not possible. And despite working for a company that makes $20–30 billion a year, that I was looking at what is my stopgap here in July of making sure my girl gets treatment for the remainder of the year until the budget resets. And that's where we got connected to NORD. And full disclosure, it's my wife who found it. and connected us to, in this case, a program that helped give us a gap program to help keep my daughter on her medication until the budget reset. And we also know the impact that it has on our lives. It's not the main reason I moved to Tennessee, but moving to Tennessee with my new firm and my insurance package has closed that gap to where hopefully I'll never have to utilize this again. But the fact that an organization like NORD provides these services to help us is a vital part of our community and extremely important, and why I am a proud volunteer and advocate of this organization. So that's a little bit about me. I'm forever indebted to this organization. I'm glad to be a big part of it. I want to reach out to the community and keep working with all you to make sure we connect others to advocacy, education, all these programs that are out there, so that we can support this community that prior to, I never would have guessed myself that it was 20, 30 million Americans and hundreds of millions globally. So with that, I'll just wrap it up by, again, saying how happy I am to be a part of this organization and spend my time, and certainly look forward to meeting more of you and working closer with all of you. So with that, I'd also like to then hand it over to one of our guests, Jill Pratt, where she would like to share her journey as well in rare disease. Thank you.
Hi, thanks, Nick. So my name's Jill. Sorry, I have this cold and my voice decided to want to go out this morning when I woke up. So hopefully you all can hear and understand me. My connection with NORD is fairly new. So while I don't have a fabulous story to share like Nick does, I do have my own journey with a rare disease. So my daughter, my oldest, I have 3 kids. Giselle's my oldest, she's 6. Genevieve is almost 4, and Beau is 18 months. So we have a full house. But my journey started with my first daughter. She has a rare syndrome called Rett syndrome, which affects probably 1 in 10,000 kids. It mostly affects girls, but you can also see it in boys as well. So with Rett syndrome and with our journey, everything kind of happened normally in the beginning. You know, we were blessed with this beautiful baby girl. We had some other medical complications not related to Rett syndrome, but we brought her home on time. She was thriving. And then about 10 months, she kind of stopped hitting the milestones that she was supposed to hit as a 10-month-old. So if you're supposed to sit up on your own or stand up with some weight on your feet, she wasn't able to do that. So we started therapy and physical therapy, and I'll never forget the therapist being like, oh, this will be easy, we'll get her there, no problem. And here we are today, still kind of on the journey. So progressing from that, we saw a bunch of specialists, had a bunch of doctor's appointments, trying to figure out what was going on. And through all of this time, I think I spent every day kind of going through the grieving process of all of that, because 1, you don't really know what's going on as a first-time parent in general with a typically developing kid, and then kind of watching all your friends going through all of these milestones and your child not being able to hit them on time, or wondering if they're ever going to hit them, kind of is a blow in your gut when you don't have a diagnosis, or you don't really want there to be a diagnosis. Because for me, I never wanted my child to be labeled or put into a box or told that she couldn't do something when maybe she could. So continuing on this journey, we never really got a diagnosis, or we didn't get a diagnosis like in writing with genetic testing until she was almost 4. So we went from 10 months to 4, not really knowing what was going on in this journey, having a whole bunch of feelings and emotions, trying to figure out, is she ever gonna walk, or is she not gonna walk? Like, what's going on? She did lose use of her hands, which is typical with Rett syndrome, and she also lost her ability to talk. So while she said only a few words, that kind of went away as well. So starting at 4, we got our diagnosis. We started our journey with like OT, PT, feeding therapy, We're basically in every therapy you can think of, kind of reading on the side. And how I had to process all of this is I had to process it alone. So while the Rett community is very strong and there's a lot of resources, I had to watch what I did because my mind was still in this comparison mode of, well, why is this kid walking but mine's not? Or why does this kid, because it's a spectrum, right? Like autism, there's a spectrum in Rett syndrome. So through all of that, fighting with schools, trying to get them to understand, because there's not a whole lot known about it, nor do teachers necessarily understand how to work with a kid with Rett's. And the biggest thing is they're completely cognitive. So while they're nonverbal and don't have great hand use, Giselle knows everything that's going on. Like you can read everything from her eyes. So it's just kind of not been a fight, but just a journey in terms of trying to figure out how do we continue to make her be the most successful that she can be. And so she started kindergarten this year. We got an eye gaze device, communicate AAC device where she can use her eyes to talk, and we're learning through all of that. But she's thriving and we're still just trying to go on a journey. So no one said that she can't walk. So I'm still working on her walking, and, we just work on it every day. So I think out of all of this, my husband and I decided to start a foundation to help other kids with needs because we understand the journey, and regardless of what your diagnosis is, it's all hard. None of it's easy, and we've been able to provide what we needed to provide to her to be able to be successful, and not everybody has that opportunity. So we just want to be able to take our journey and provide a community of support, kind of like Nord's doing, and financially help other families. So it's probably like a rambling journey, but that's my journey with a rare disease. We're still on this journey. It's, never going to end. And, just kind of have to continue to process what's coming. For me, processing what does life look like in the future and even today. So you just got to take day by day and keep moving one foot forward. So that's my journey. Thank you for having me. I'm blessed to be able to share it with all of you.
Thank you so much, Jill, for sharing your story. Just the courage in your words and your optimism is enlightening. Thank you. So now we're going to switch gears, and I have the privilege of introducing Dr. Scott Strom. Dr. Scott is the Executive Dean of the College of Medicine at the University of Tennessee Health Science Campus, and he's also the chair of the Tennessee RDAC. He's internationally recognized as the head and neck surgeon, who is the Executive Dean of the University of Tennessee Health Science Center, College of Medicine, and also the Vice Chancellor of Health Affairs at the university since 2018. Dr. Strom came to the University of Tennessee from the University of Maryland, where he served as a professor and chair, the department head of neck surgery for over 13 years. As a respected cancer surgeon and investigator, he brings both research and clinical expertise to the University of Tennessee. As a clinician, researcher, and entrepreneur, Dr. Strom has particular expertise in treatment of head and neck tumors, thyroid cancer, and diseases of the anterior skull base. He continues to focus on the quality of patient outcomes and cutting-edge advancements in biotechnologies. As said, he's now in 2021 elected as the chair of the newly formed RDAC for the state of Tennessee. And at this time, I'd like to welcome Dr. Strom. Thank you.
So first of all, thank you so much. It's really a privilege to be here and represent all of the folks with rare disease in our state. And as the dean, it gives me a rare look at essentially a lot of different features of healthcare within our state. And so our goal at UT is to make a difference in the lives of every single patient we touch and really try and help everybody in our state who is in need, no matter what their financial circumstances, no matter what their educational level or their background. That is what we're here for, and we are 100% committed to that mission. By way of background, I've been involved in making drugs all my life, all my professional life, I should say. When I was at the Mayo Clinic, we made the drugs that are typically known as immunotherapy drugs that you may hear on TV for cancer. So I have a little bit of experience doing that. And we also now make drugs for rare disease, some drug which is an intravenous immunoglobulin mimetic. So we work a lot on that as well, trying to make sure that people who have those drugs or have those needs can get those drugs. In RDAC, I'm very proud of our Tennessee RDAC, and really Terry Jo and Jillian Hooker deserve a wonderful amount of credit because they've been really spearheading that going forward. We started our RDAC about 6 months ago, and we obviously had the legislative outlines of what we have to do, but then we took some poetic license to really figure out what is it that we can do to help the most people in our state, and how do we actually begin to do that. We focused initially on a communications platform with individuals so that people would not feel alone in our state, so that anybody who had a rare disease could have someone to reach out to and talk to. And we're doing that through a website that will be dedicated to rare disease, or the RDAC, in the state of Tennessee. That's going to be hosted initially on the UT platform, but ultimately my hope is that we'll have its own platform. And then so folks can ask questions, and we'll have a resource page so folks can get the resources that they need and that we can help them. We've also been working very hard on trying to define, there's a lot of things that you can do. And what I want to make sure is that as the leader of this committee is that we really figure out from our rare disease, I'm going to call them constituents. I don't in any way mean that in a pejorative word, but constituents, what is the best way to help? And so you could figure about, okay, well, a person, as Jill beautifully described her story, really doesn't know for the first several years and has feelings of isolation, has feelings of, hey, I just don't know how to get an answer for my daughter. And so the first thing is diagnostics. How do we make sure that folks can get an appropriate diagnostic for their person, for their loved one? The second thing is, how do we make sure that a person living maybe in rural Tennessee has access to a specialist that they need to care for their child or their loved one without incurring undue expense? And how do we make certain that that happens? And then the third thing for us is, and this was brought up today by Nick. Nick, thank you for your beautiful story that you shared with us. How do we make sure that folks, everybody, whether you have means, don't have means, et cetera, has access to potentially life-saving drugs? And then finally, how do we as a community begin to support diagnosis and discovery of new therapeutics? Now, you could whittle away at each of those things, and clearly each of those has merit. But what we're trying to survey is the communities afflicted with family members who have rare disease, to get their input, to help guide us on what were the most important things in their journey, so that we can start somewhere and so that we can achieve something. And we right now be all things to everybody. My hope is that we can start, and you know, there's a thing in the Old Testament. It's called tikkun olam, and what that means is that there's cracks in this world, and you can't fix every single crack, but you start to heal the individual cracks that you can heal. So what I'll be looking for, and what we're looking for, is guidance on where to go next, and what are the major items that that folks want us to tackle. I view us as public servants, and all we want to do is good. And so that's really what we're trying. So we have a survey that's going to be coming out, led by one of our committee members. We'll be querying the rare disease community across the state so that we can get some direction on where our state and where our the folks who have rare disease, how we can help most. And what I'll do in closing is I'll put my email up. Yes, I'm the dean of UT, but really I'm a doctor. I like taking care of people. I like helping people. And if I can ever be personally of help to anyone, just, you know, shoot me an email, and I'll make sure that you get connected with the right people to help. And, you know, that's what we do. So I wasn't exactly sure whether that was what I'll say you all, because I'm a very proud New Southerner. And so I hope that was said correctly, but I wasn't sure that that's what y'all needed to hear or wanted to hear. But hopefully that maybe started off the conversation. So once again, I really feel privileged to serve in this way. And I really, really appreciate everyone's time and commitment to folks struggling with rare disease. So thank you.
Thank you, Dr. Strom. Thank you for your compassionate leadership, and we're really grateful to have you as chair of the Tennessee RDAC. Next, I'm going to introduce Senator Shane Reeves. He has sponsored the legislation that actually formed the Tennessee RDAC. Senator Reeves is a Tennessee state senator from District 14. That's Middle Tennessee, south of Nashville, including Murfreesboro, Shelbyville, and Lewisburg. Senator Reeves is a pharmacist, a business owner, and healthcare leader who uses his experience in the private sector to serve the Middle Tennessee community. So welcome, Senator Reeves.
Thank you, Amber. Can you hear me? So sorry I missed the first part of your meeting. As she said, I am a pharmacist, and I'm in my pharmacy business today, and it's COVID vaccine, and it's just crazy here right now. I've got all I can stand, so I really wasn't able to jump in here and be part of all of it, but I'm just thrilled to death that this advisory council is meeting. You know, as a senator, and I haven't been a senator very long, it's thrilling to see a piece of legislation actually move and become a council, and then that council becomes a voice. And now this voice is becoming an influence in our state for chronic, complex, and rare diseases. You know, one of the things that I felt very early, and I said this as this council we were considering forming this council, is, you know, Crohn's disease is not about being a Republican, and multiple sclerosis is not about being a Democrat, and Lou Gehrig's is not liberal, and cystic fibrosis is not conservative. These are all rare diseases, and they impact the lives and wreak havoc on the health of thousands and thousands of Tennesseans without discrimination. And my hope was this council would just be able to come together and be a voice for those in TennCare and the Department of Health to make good decisions, because it's very different treating cystic fibrosis than it is treating high cholesterol. And we truly needed to be in a position to be able to provide good feedback, like I said, to TennCare. Interesting enough, I've actually been asked in the last, this session, I'm in the process of trying to form another task force or advisory council around another big issue we have in Tennessee that's much larger, just around obesity. I mean, we currently are number 35 in the country in adult obesity, and we're number 44 in children's obesity. So taking a look at maybe trying to form a task force around that as well to continue to inform TennCare. But thrilled to death your meeting. I'm encouraged. Please let me know if you have any questions or if I can be an encouragement to what you're doing, but excited to see the fruits of your good labor playing out in public policy in the state.
Thank you, Senator Reeves.
Thank you.
I think next we're going to do a short Q&A session to see if anyone has any questions for Senator Reeves while we have him, or Dr. Strom, or any of us from the Rare Action Network.
I'd just like to comment for Senator Reeves and just publicly thank him for his insight into really helping or spearheading the development of this committee. And, you know, Senator, as the Dean of UT and you know, we're the largest medical school in the state, and we're across the entire state. If we could ever be of service or help, you know, please feel free to reach out to me or any of our team, because we would love to partner with you as you seek to improve the healthcare of Tennesseans.
Thank you. It is my passion. It was my passion before I ran for office. I went to MTSU to undergrad, but I went to UT Pharmacy School in Memphis. Back when I graduated pharmacy school in 1994, we only had one pharmacy school. We've got 6 in Tennessee now, but I went to UT Memphis and graduated in 94. So at the end of the day, before I'm a business owner and a CEO, I'm a clinician at heart. I really am. I care about patients. I care about the health in the state of Tennessee. And it's of the 45 bills that I'm carrying this session, at least 20 of them are healthcare focused bills coming to me from hospitals and nursing homes and home health agencies and physician practices and pharmacists and caregiver groups. So it's all around simply trying to make healthcare in the state better and more affordable and more accessible, high quality. It's what I do. But I appreciate you very much. Anything else anybody got on your minds I can help you with?
I just have one thing to say besides thank you, and that is to brag a little bit about our state, that we were the first and only state in the country that moved adults with disabilities up to the 1A1 category to get vaccinated. And it is just amazing. I am so proud of the way that Tennessee has gone about distributing the vaccine. Of course, we can always do better, but
I think you cut out there.
Keep up the work.
So I missed some of that at the end. So I sit on the governor's vaccine task force, and probably some of you as well on this call might sit on there with me, but I tend to agree. I think we've done a good job on that in the state in the way we've managed it and how we've categorized and organized it, and we're making great progress. And I mean, I know in my little communities, which is Rutherford, Bedford, Marshall, Moore, and Lincoln, you can already kind of sense it. We're just developing a little more herd immunity. We're getting more vaccinations. People are a little more comfortable. Our numbers are trending in the right direction. Our hospitalizations are going down in my communities. The number of cases are going down. So, I mean, I'm optimistic by the time we get to the end of April that we may not be mask free, but we'll be thinking about having a mask burning party sometime this summer.
Great. Well, thank you so much. As a new Tennessee resident, it's been amazing to move here and see so many great advocates, and especially all your support, Senator Reeves. So thank you so much.
Glad to do it. And it's, you know, healthcare is so complex, I find, for people that are not in the space. You know, I look at the Tennessee Senate, and there are some people that touch healthcare, but you know, when you get to talking about the complexities of disease like this, and you're talking about insurance payers and providers and PBMs and all these, I mean, just in the pharmacy space alone, you're talking about step therapy and prior authorizations and formulary management. People just don't get it. I mean, they're just not their space. So it's so important to have individuals like yourself that do know what's going on and you get it, and you're able to share it with the Department of Health and TennCare and others to help them make good decisions, because we truly need to be implementing best practices in the state of Tennessee for our patients with chronic, complex, and rare diseases. And glad to be part of this call with all you smart people.
Thank you so much. Well,
Okay.
I will leave it open if there's any other questions that anyone would like to either drop in the chat or take yourself off mute, then you're more than welcome to. Okay, well, I will move on to our next piece. I am thrilled to introduce one of our amazing volunteer state co-ambassadors here in Tennessee, Amber Sapp. So with that, I will turn it over to you, Amber.
Lisa. So like Nick said earlier, I tend to get emotional sharing our story of my son's rare disease. It's been 11 years since diagnosis, but don't mind me if I get a little teary. My 14-year-old son, Garrett, was born in 2006. You know, I can still remember the way he felt on my skin when the OB placed him in my arms on July 14th. He was my first child, the first grandchild, and the first great-grandchild, which means he was completely and utterly spoiled. He had this little round head that was perfect for these little golfer's caps I used to make him wear to church even when he was a little baby. His first word was mama, quickly followed by ball. My husband and I had visions of him playing baseball in high school like his dad, and for being a protector for his little sister Charlotte, who would come along less than 2 years later. When Garrett was about 3 years old, the physical therapist in me began noticing some subtle signs that were concerning. He struggled to climb hills at the park. He got tired quickly, and he pushed up on his legs to stand up from the floor. A technique I had learned in physical therapy school was called a Gower's maneuver, and the hallmark of a terrifying disease I couldn't even utter the name of. I took him to the pediatrician and I voiced my concerns. The pediatrician assured me that he was not concerned, but he went ahead and did a CK test at my request. The next day, I received a call from the pediatrician informing me that my suspicions were correct. I fell in a crumpled heap in the floor when he said, "Your son has Duchenne muscular dystrophy." When we finally got an appointment 3 months later with a Duchenne specialist at the Children's Hospital, the neurologist entered the room with this large, beat-up black medical bag. He reached deeply into this bag and pulled out a pink rubber ball, and he dropped it on the floor, letting it bounce across the room. Of course, my curious 3-year-old boy chased it and did his best to catch it, while the neurologist merely watched how he moved. No physical exam was performed. No gentle reassurances that my boy would be fine or that there were potential treatments on the horizon. He simply said these words that are forever burned in my mind. "Take him home and love him. There's nothing you can do for him." I told my husband then and there, that will never be said of me. Duchenne muscular dystrophy is a rare muscle wasting disease that primarily affects boys. There's no cure and no viable treatment. One day at almost 12 years old, he was walking, and that evening his legs gave out, resulting in 2 broken bones, and he never walked again. One day he was able to feed himself, and now he cannot finish a meal without having help to lift the fork to his mouth. One day he could squeeze me with both arms in a hug, and now I have to lift his arms to place them around my neck. Duchenne robs young men of their muscles, arms and legs, yes, but also the muscles required for breathing, and the heart muscle as well. Most young men will succumb to their disease in their early 20s because of pneumonia or heart failure. And while Garrett's condition has continued to decline these past 11 years since his diagnosis, I assure you that neurologist's words will never be spoken of our family. There's nothing you can do for him. I promise you this, there is always something you can do. Garrett has been a part of several clinical trials in hopes of changing the outcome for himself and others. We host a local 5K event every year to raise money for an advocacy group that's close to our hearts. We connect with like-minded families in the rare disease community for fellowship. We engage with policymakers and representatives to voice our concerns. We became the experts in our child's condition when there were none. We share our story. Alone we are rare, together we are strong. That's all I have.
Great. Thank you so much, Amber. Thank you for being such a great advocate, and we're just so lucky to have you. And very proud to have you in my new home state. So thank you so much. All right, so lastly, after the event, we will be randomly selecting 2 winners from the attendee list to receive these Rare Disease Day swag bags seen here. Winners will be contacted via email this week and receive their prize pack sometime in mid-March. So good luck with that. And I have a video to wrap us up here that I will pull up in a moment.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the Volunteer State Ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our states.
And thank you for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told, when you hear hoofbeats, think horses, not zebras? Well, what about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
Great. Well, thank you all so much for joining us. One thing I did want to share is Sunday, the Korean Veterans Memorial Bridge in downtown Nashville is going to be lit up in honor of Rare Disease Day. So if you are in the area, please go ahead and check it out. And then Terry Jo, can you remind me what time it's going to be lit up?
Actually, Dr. Chip Chambers is on the call. Chip, can you speak up and tell us about the bridge?
Well, I will defer to my right hand in the Data 2 Foundation, Kristen, who's been leading this up. So you can, it was her idea. It wasn't my idea. She's 10 times better than me.
Yeah. Well, round robin, right back to being Nord's idea, but we just jumped on it. I think all day. Could be, but I'm not sure the time frame. They didn't give us a time frame. They just said that we had Sunday reserved.
Perfect.
I'll also tell the group we have an op-ed in the Tennessean that just came out digitally that'll be run Sunday. So we did it to raise awareness. So if y'all can comment on it or like it or dislike it if it sounds crazy, that'll just keep the buzz with the media that when we want to come back to them that they'll hear it. They'll want to hear from us.
Yep.
Great. Well, that is exciting. I'm really excited to see that lit up. Well, with that, I will, if Terry Jo, Nick, Amber, you want to have any closing remarks before we end our meeting?
My sound is so terrible. I'm going to talk really fast and say thank you to everyone. And we're going to get a lot of great work done this year. COVID be damned.
Anissa, could we get everybody to turn their video on maybe and do a little group photo shot for social media?
Yeah, I think that that's a great idea. So let me see how to format this. I know that there's a way to do a Brady Bunch version here. Video settings.
I have it. Anissa, if you want me to take a screenshot.
Yeah, that would be great if you could format that. Thank you.
In 1 second, I see some additional people. Please put on your almost 100% of people. Let's see. Okay, everybody look up, right at your camera and smile real big. Don't look down. It's a new way to take photos, right? Here we go. We're all set.
Perfect. And then would we be able to drop that in the chat box? I don't know if not.
Yep. 1 second.
So much, Jamie. You're awesome.
For good measure, let's take one more. I'm going to move myself to the corner because my face was distorted. Okay. Again, look up at your camera, smile real big. Here we go. Awesome. Great looking group of people. Give me 1 more second, I'll send it over.
Great. Thank you so much. And I can also, if it's easier, email folks the picture afterwards that registered.
There it is.
Perfect. Thank you so much. I will save that also. Perfect. So I will give everyone a second if you want to go ahead and save that. Great. All right. Well, thank you all again so much. This was a great event, and we appreciate all of your advocacy efforts and all of our RDAC leaders and everything that everyone does to make health a priority in Tennessee. So thank you so much. Have a great rest of your day.